Leg and foot problems in children can result from developmental variations, injuries, or medical conditions. Here's an overview of common issues. 1. Developmental variations, flat feet, pes planus. Many children have flat feet due to immature arches. Flexible flat feet are normal and improve with age. Rigid flat feet with pain may indicate underlying issues like tarsal coalition. Bowlegs genu verum, common in toddlers and typically resolves by age 2 to 3. Persistent or severe bowing could indicate rickets or Blount's disease. Knock-knees genu valgum, often seen in children aged 3 to 6 years, usually resolves by age 7 to 8. Severe cases may need medical evaluation. Intoeing pigeon toes, caused by femoral anteversion, tibial torsion, or metatarsus adductus, often self-corrects with growth. Toe walking, normal in toddlers learning to walk. Persistent toe walking can be due to tight Achilles tendons or neurological conditions like cerebral palsy. 2. Overuse injuries, Sever's disease, calcaneal apophysetis, heel pain due to irritation of the growth plate. Common in physically active children, especially during growth spurts. Shin splints, pain along the shin bone caused by repetitive activity. Rest, ice, and supportive footwear can help. Stress fractures. Tiny cracks in bones from overuse, common in athletes. 3. Congenital conditions, clubfoot talus equinovarus. A deformity where the foot twists inward and downward. Treated with stretching, casting Ponseti method, or surgery. Congenital vertical talus, a rare condition causing a rigid flat foot appearance. Requires surgical correction. 4. Neuromuscular and systemic conditions, cerebral palsy. Affects movement and muscle coordination. Can cause tightness, abnormal walking, or leg deformities. Muscular dystrophy, progressive weakness in leg and foot muscles. Needs supportive therapy and management. Juvenile idiopathic arthritis (GIA). Causes joint inflammation, pain, and stiffness. Managed with medication and physical therapy. 5. Common symptoms of concern. Parents should seek medical attention if the child experiences persistent pain or swelling, difficulty walking, or delayed milestones. Noticeable deformities, for example, twisted or asymmetrical legs, feet, frequent falls or instability, pain during or after physical activity. Treatment options, observation. For self-limiting conditions, physical therapy to improve strength and flexibility. Orthotics and braces to correct alignment or provide support. Medication. For pain or inflammation, for example, in arthritis. Surgical intervention for severe deformities or conditions unresponsive to other treatments. Would you like more details about a specific condition or advice on when to see a pediatric specialist?